Hello and welcome to my channel. Today we will discuss some basic introduction about the binocular vision. Okay, so the binocular vision is the topic which you need to cover in your third year optometry course. In the fifth and sixth semester, you need to study the BV1 and BV2. So, in the BV1, there are some terminology related to the binocular vision, and we will discuss all those things in today's video in a very brief. Okay, so uh, the first of all we need to know that what is binocular vision, okay, and what are the essential components of the binocular vision. Okay, the binocular vision name implies that when we are seeing any object with two eyes open, okay, so that is the binocular vision. We have two eyes, and when we use both of our eyes to see any object, then it is the binocular vision. It's so simple. Then what are the components or essentials of binocular vision? So there are three components of binocular vision. Okay, so what are the three components? So the first of all is the simultaneous macular perception. In short from it is called SMP. Next is the fusion, and third is the stereopsis. So these are the most important components of binocular vision, and these components need to be present or required to be present to make a complete binocular vision. So the binocular vision is not a terminology, rather it is a process, and in this process these are the steps. Okay, so what do you mean by simultaneous macular perception or SMP, isn't it? So the name implies that simultaneous means it occurs in the same time, and macula, it is a part of our retina where the fovea located and where the highest visual acuity is present. Okay, so we have two eyes, and these two eyes have two different fundus, and two different fundus has two different macula, and in the macula there is fovea. So the fovea of this eye and the fovea of this eye. Okay, now imagine there is a septum, there is a divider. Okay, and this is the right eye. Okay, so this is the right eye and this is the left eye. So suppose now there is a object like flower is present here, and in the left side there is an object like book is present here. So if the person can see the flower and can see the book at the same time, this means that the two macula of that patient's eye is perfect, and there occurs simultaneous macular perception. Okay, so this is the first grade of binocular vision known as the SMP. Suppose if in one eye of that individual there is any kind of macular disease like macular hole or diabetic maculopathy or others, so in that case there one eye is not working or one macula is not working, so there is simultaneous macular perception is partially occurred. Okay, now the second component of the binocular vision is the fusion. Okay, so fusion in a simple word you can say that fusion is nothing but it is the superimposition of two different images. Okay, so we have just learned that simultaneous macular perception. So let's suppose this the one individual is present, and it is the right eye of that individual and it is the left eye of individual. Okay, now by the right eye the individual can see a bus in which the front wheel of that bus is absent, and in the left eye the person can see that a bus where the behind wheel, okay, behind wheel of that bus is absent. Okay, but so this is up to this is the SMP, simultaneous macular perception. But when the next step of the binocular vision occurs, the fusion occurs, the person can superimpose these two images and finally see a complete image of the bus where the two wheel of the bus is present. Okay, so by superimpose two incomplete image, when we can see a complete images, this is the process of fusion. Okay, and this is the very most important part of the binocular single vision. If the fusion is not present, then we have binocular vision, but the then it is the binocular double vision. The fusion is that essential component for which we can see a single object in spite of we have two eyes. Okay, now the third and the most important components of the binocular vision is the stereopsis. Okay, so stereopsis means in simple word it can be said that it is the depth perception. So depth perception means that it is the measurement of distance. Okay, it is the measurement of distance. Okay, so measurement of distance, here we cannot measure, or we don't measure the distance by scale or by any other machine. We measure the distance only by the our two eyes. For example, suppose it is a road and this person A is try to cross the road. Okay, and a car is coming here. So now it is the person A who have the both simultaneous macular perception and fusion can measure the relative distance between this car and him, and simultaneously he can also measure this distance and calculate the time to cross this road safely. Okay, so this is the real life example of the depth perception or stereopsis.